Hey everyone, I'm Marques, your neighborhood vet from Pet Based Channel, and today we're digging into something really crucial for your pet's health. Ever stop to think about how nasty sewer water and floodwater can be for your fur babies? Stay tuned because what I'm about to share could save your pet's life. Ready? Let's roll. Before we dive in, let's understand why sewer water, floods, and the like are so gnarly. Did you know they can carry some bad stuff like chemicals, sharp objects, and bacteria? Alright, let's dive deeper into the health hazards for our pets. Coming into contact with such water can lead to skin irritations, diarrhea, and the infamous leptospirosis. It's essential you know the signs so you can act fast if your pet shows any symptoms. When it's rainy season and there's flooding everywhere, we need to be on high alert. The first disease that probably jumps to your mind is leptospirosis. We know that leptospirosis comes from rat pee and is easier for pets to catch it during floods, but let's dig deeper into this disease, because it's not only dangerous for your pets and wildlife, but also for humans. Leptospirosis is classified scientifically as an infectious disease. It's a global issue and it's caused by a bacteria from the Leptospira genus. Fun fact, there are actually over 250 types of this bacteria that can make you sick. This bacteria spreads through contact with urine from infected animals or symptom-free carriers like rats. Rats can be infected by the bacteria, but they don't show signs of it. Basically, the rat is fine, but it keeps peeing out bacteria. So why are floods and inundations a bigger risk? Because the bacteria, usually in one specific place, get swept up by the water, and anyone who comes in contact with the infected water can get infected. The bacteria can enter through cuts and scrapes or even on undamaged skin. Leptospirosis can present differently in dogs and cats. It depends on the age and immunity of the animal, how aggressive the bacteria is, and what body system it attacks. Also, it can flare up as either an acute, subacute, or chronic disease. Firstly, the bacteria make their way in through the animal's skin or scrapes. It multiplies in their bloodstream and settles in organs like the spleen, liver, and kidneys. Leptospirosis favors the kidneys where it will reproduce, and the animal will pee out the bacteria. In this early stage, your pet might have a fever, shake, feel weak, be inactive, throw up, and have diarrhea. As the disease progresses, they could develop purple spots, yellowing of the mucous membranes or jaundice, abdominal pain, and a sore back. In acute cases, the disease can cause a clotting disorder and can suddenly be fatal in 2 days. This usually occurs with a type of bacteria called the Icterohemorrhagiae serovar. Chronic infections usually involve a type called canicola. This can severely damage the kidneys and develop into chronic renal failure. Pulmonale and Gripotyphosa serovars cause loss of appetite, depression, throwing up, peeing more often, drinking more, muscle pain, throwing up, and diarrhea. And the subclinical form is when the animal is infected, but doesn't show symptoms of the disease, but still pees out bacteria. So basically, when a diagnosis is clinical epidemiological, it means that it's the combo of a patient's symptoms and the chance that they've been around something that might have the infection. To confirm the disease in critters, there are several lab tests which can be done, like serology. Most times it's a serious illness and your pet needs a vet pronto. Often pets need to be admitted to the pet hospital, and sadly, even then, sometimes our furry friends don't make it. So the very best way to keep them safe from leptospirosis is prevention. First up, you should stop your pet from coming into contact with things that might be infected, like dead animals, rats, rat pee, sewage, flood water, and stagnant water. If you're living somewhere where it's tricky to keep your doggo away from these sources of infection, you've got another prevention choice: vaccination. The vaccines currently available can protect against the most common strains causing the disease. Multi-strain, these are the yearly ones vaccines, have protection against some leptospirosis strains. In the V8 vaccines, your pet will be protected against the Icteromorrhagio and Canicula strains. The V10 vaccines protect against Icteromorrhagio, Canicula, Pomona, and Gripotyphosa. The V11 vaccine protects against 5 strains of leptospirosis: Icteromorrhagic, Canicula, Pomona, Gripotyphosa, and Copenhageni. V12 vaccines protect against 6 strains: Icteromorrhagio, Canicula, Pomona, Gripotyphosa, Copenhageni, Paragenes, and Dachshundi. It's important to remember that vaccination plans should be tailor-made for each pet. thinking about where it lives and the chance for it to be exposed. If your pet is diagnosed with leptospirosis by a vet, they'll need a strong treatment plan to support every affected system. Plus, they'll need an antibiotic that kills the bacteria. The antibiotic's goal is to kill the bacteria, but also to reduce the amount the pet's kidneys get rid of, because even after the pet shows no signs of the disease, it can still pee out the bacteria for a long time. I hope that this info has been helpful and you can use it to care for your pet. Remember, prevention is key when it comes to keeping your pet safe, particularly when there is a chance they might get into contact with flood water or sewage. If you liked the video and thought the advice was handy, you're probably also gonna like our next piece of content about diarrhea in dogs. I'll put a link here for you. Share any questions or experiences with us in the comments. We're here to help. Thanks heaps for watching. Stay mindful of the weather, but most importantly, look after your fur baby. Catch you in the next video.